I'm speaking to you from a very practical application. To begin by giving you a background of my history and how I got into alternative health care. As you can see on the screen, I have a picture of my son and my new grandbaby. And I got into this roughly 21 years ago. My son that you see on the picture, when he was born, he was diagnosed with the asthma that children die from. I do not say that lightly, because from the time I took him home from the hospital until he was 3 years old, he was on 3 types of steroids at the same time. He had been on 2 solid years of antibiotics, and I used to go to bed at night and sleep on, after my husband went to sleep, I'd go get in his room, and I would lay on the floor and listen for him to breathe. When he was about 3 years old, a friend of mine told me about alternative healing, and I was a skeptic. I was like most of my clients that come and see me. I had no concept of what alternative care was. I thought it was something mystical, and so I had turned her down. Well, the asthma medication that he was taking had started destroying his liver and his kidneys, and so he used to, at 3 years old, walk around with a bucket in his hands, and he vomited 5, 6 times a day. And he looked like he was out of National Geographic, where he had the belly and the gaunt face. And so I reached that point where I had nothing else I could do. From 3 years old until today, 24, he has not had one asthma attack. He's not been on medication for anything except when he broke his leg and they had to put a rod down it. And that was about 2 years ago. Up to that point, he had not even had ibuprofen in his system. So when I speak about asthma tonight, I am literally speaking from the heart. It is something I have lived. It is something that I studied for. I started to study for my family, and from there it just turned into the business that it is today. So that is a picture of my son, and again, he's an electrician. He does photovoltaics, so he's under houses, in attics. He does everything that you technically, according to the medical profession, should not be able to do. And that is his son, Michael. So we have, and that is my son, my daughter-in-law, my wife, his baby, and that's us. So let's get on to this topic on asthma. Give me my breath back is what I've titled it. What is asthma? Asthma is a chronic condition in your lungs that has 2 main components. When you have asthma, 2 things happen inside your lungs: constriction, the tightening of the muscles surrounding the airways; inflammation, the swelling and irritation of the airways; constriction, inflammation caused by the narrowing of the airways, which may result in symptoms such as wheezing, coughing, chest tightness, or shortness of breath. Furthermore, there is an increasing evidence that if left untreated, asthma can cause long-term loss of lung function, and I would agree with that. Now, asthmatics are one of the fastest growing medical demographics in the U.S., with roughly 20 million people afflicted in 2008. That's from the Mayo Clinic. Now, we're here in Northern California and in the Valley. In the Valley of Northern California is lots of agriculture. So allergies, asthmatics, bronchitis, pneumonias, that is a very common thing that we see in the valley. Inflammatory triggers. Now, as I talk about triggers, one of the things that I want to make as a point is a trigger is simply a trigger. Mold, pet dander, dust mites, pollen, all of these wonderful things that we're all around all the time. These are triggers, and we really do not want to focus on them. Viral infections, we do. But triggers are something that really are just what has triggered the issue. So we're going to kind of bypass this because they do not cause the inflammation, but they provoke twitchy airways, especially if they're already inflamed. Smoke, exercise, cold air, all of this. When it was my son, he could not go from one side of the house to the other side when he was 3 years old in the winter because of the coldness. And if anybody has fireplaces on, which here in the valley, we use on a regular basis, it was something that would send him to the emergency room. Food additives, air pollutants, intense emotions. If we told him we were going somewhere, then he was excited, he would have an asthma attack. Very, very, very common. Frequent coughs, losing your breath easily or shortening of the breath, feeling very tired or weak when exercising, wheezing, coughing, other exercise, all of these point to asthmatic conditions. Sneezing, runny nose, nasal congestion, sore throats, headaches, all of those are just signs of anything that can lead to bronchial inflammation, trouble sleeping. All of these drugs here, and I'm not going to go into each one of them, that most people are put on and are told that asthma is something that you learn to live with. I personally disagree with that. I think that you can defeat it. Step one, these are things that I have come to the conclusion in my practice at my office of if somebody comes in and they say, I'm bringing my child to you, or it's an adult, and they say, I have asthma, what can you do? The first thing that we want to start to look at is their digestion and assimilation. Generally, 9 out of 10 people have food allergies. 9 out of 10 of them are going to have candida, leaky gut, all kinds of digestive problems, and that is why they start to have triggers. So the first thing that Inno-Vita has that we want to talk about tonight is Digesta. Digestive enzymes. I put all of my clients past the age of 25 automatically on digestive enzymes. All of the years that people have drank soda or any carbonated beverage, they lose their digestive enzymes. So one of the very first things with asthma that you want to look at is their digestive tract. The second thing is what happens is when people start to become hyperallergic, asthma or allergies, just allergies in general, is their adrenals are working overtime, and so then they actually start to decrease. Now, what's kind of cool about Inno-Vita is their Adrenex in both of these products, but their Adrenex, it's not a pusher. It doesn't stimulate the adrenals. It gently works and creates the adrenal gland to start gently working again. So with asthma, asthmatic people, their adrenal glands have either overworked that they totally start to shut down, or maybe like with my son, he was born and his endocrine or his adrenals were never developed properly. So with children, especially, you want to check and see is their adrenal glands working, because that's where the histamine is going to come up. The other thing, and I call this my baseline trilogy here, is spleen. Spleen, adrenals, and digestive. Because spleen is you're going to clear up the body, you're going to clean up the blood, and when your spleen is very healthy, then your lymphatic system can start to work and process and remove the toxins that are actually the triggers. So what you've got here is the digestion, food allergies. Children that have asthma have tons of food allergies. So you want to do the digestion. Then you want to go in and clean up the system, clean up the spleen so that their filters start working appropriately. And then look at their adrenals. Where is their histamine? So that they can naturally start to fight against the triggers. Now step 2, what we have here, is now you're going to go deeper. Generally with the digestive, the adrenals, and the spleen, you're taking the person, the asthmatic person, or the person that is hypersensitive to allergy. Every year, Kathy, I come in, and for 3 months I have allergies, and then I get a sinus infection, and then I get bronchitis or pneumonia. Well, when you do step 1, you've taken the trauma off the body. You're allowing the body to start to heal itself. But now as a practitioner or as a consultant, what you want to now go and say, okay, what's been the long-term damage? Like with my son, he had been on antibiotics at the yin-yang, and then he's on all of these steroids. He definitely had candida and a bacterial infection. So now you want to go deeper and look at Inno-Vita's Bacto-X. Check them out for that. And I do what's called a marriage. So I will put the Bacto-X and the Permi-Lung together at a separate time away from step 1, so that way I'm specifically targeting the lungs. Now, yes, it's obvious we need to check the entire body, but tonight we're looking at specifically asthmatics, allergies, or the lungs. So you want to create that marriage, because then you're asking the body to do a singular task, take care of the bacterial in the lungs. But also the really nice thing about the Inno-Vita line is when you look at the lung, the Permi-Lung, it's not just going to clean it up. It's literally going to go in there and reset it, help it to have oxygen in there, and to heal the damage that has been done from long-term asthma. Now, what if you test them and you go, okay, there's no bacteria needed, which I know there would be, but let's just say that, but maybe there's a virus that is in there. Again, then use that as a triad and put all 3 of those together at the same time. But you definitely want to look for it. Now the very last thing here, and you can do this last thing at any time during the day, but you always, 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 always want to drain them. So if you're going to get rid of the bacteria, if you're going to work on the virus, you want to drain the body. So Tox-X removes waste, removes toxins. It will literally drain it. What I call it, it's like the lungs and the system is like a swimming pool where we're all pH balanced, and we know that. But if you've left that, like in my son's condition, where for 3 solid years as a little one, he was out of pH balance. So his lungs had started, in his lymphatic system, even with a little one, had filled up with fluids and bacteria and food sensitivities and triggers. Well, you've got to be able to go in there and fix that. If you're going to go in and clean up the bacteria and the virus, it's like in a swimming pool. Somebody goes in and they put chlorine in there, but if they don't turn on the filters, drain the bad stuff out and allow it to have a place to go, then you're creating more of a problem than what you started with. So you always want to remember to drain the system. Now, we're going to go ahead and move on to hormones. We have energy, metabolism, hormones, brain, and the brain chemical. What we want to look at is the female hormones. But I've kind of done a little bit different in here. And just over time, some of the things that I've noticed, it's more than balancing the female hormones, progesterone, estrogen, testosterone, is we have to look at the entire endocrine system as a chain. Because what happens with the adrenals or what happens with the thyroid is going to affect the hormones. I have now been seeing clients for 16, I'm in my 16th year. In doing that, you learn more every year, obviously, and the more I've studied, and then with what I've seen, is when I balance a woman or a man, and we balance the body first, and then secondary, I go into the hormones. The hormones are so much simpler to balance. So if I have a woman coming to me and she says, I'm going through menopause, or a young woman coming in and saying, my PMS symptoms are just off the chart, that is what I'm coming to you for, Kathy. I generally don't even, believe it or not, start to work on that for the second or third appointment, because I want to go in and basically balance the endocrine chain and see if everything is in balance there. So what changes a woman's body? Menstruation, pregnancy and birth, work life, social life, stress and stress and stress and stress. What I'm noticing is the thyroid on women that I used to do thyroid support in their 30s and 40s. Now I'm doing thyroid support in high school girls and in young adults, which never was because of the stress and just the lifestyle that young women are having today. So as we look at this news flash, her glandular system is in chaos. Now, as we go through here, we're going to look at some of the things that we're finding, in here that is stress. Stress response system. This is kind of fun, and this is something I've started doing an intense study on myself in the last 3 years, is the hypothalamus. Now, when we look at the stress response system, we're seeing the hypothalamus, the pituitary gland, the adrenal glands, the cortisol, the immune system, the brainstem, and the medulla. But one of the little things that I found that myself the first 10 to 12 years I was really under dealing with is hypothalamus. Now, the hypothalamus does have a lot to do with weight loss, memory, and emotional stress. It is huge. Hypothalamus is that little gland that's up inside the skull, over the ear, that runs hand in hand, like if you had a yin and yang, with the pituitary gland. The hypothalamus is our little memory keeper. That little tiny gland is the gland that sends out into the body trauma, stress. She's under stress, and that little gland can be left on. And how I ask my clients about that is, do you feel like you have a tape that runs in the brain, and you constantly are thinking about something, or you're constantly feeling stressed? You may be on vacation and you still feel stressed. You get off of work and it's the weekend and you can't seem to sleep well at night because you're thinking about your next day's task. Well, that's coming from the hypothalamus. And that hypothalamus is what tells the pituitary and the rest of the endocrine system and the adrenal glands and the cortisol and the testes, or anything that's the ovaries, anything that's in that endocrine, and it tells it, hello, we're still under stress. So again, in my opinion, in the last few years, is if I don't deal with the endocrine system as a whole, or especially that hypothalamus, how can I then balance the hormones? So that's just a little bit different way that I've come to think about it in the last couple of years. So brain chemistry and then hormones. And then obviously, because of the thymus gland, your immune response is going to be significant here. So now let's go ahead and move on to our body shape. As you can see from here, there's all different body shapes. So you're going to have the adrenal body shape. You're going to have, I'm going to show you a different picture of them. And I have on here, if they're overweight, ask them, and if they ever were, because with so many of the surgeries and everything else that's going on, how were they and what did their bodies look like? Because we have different shaped bodies, and the different shaped bodies are going to help you do a visual intake of their bodies to help you see where are they in stress in their thyroid, in their adrenal glands, which is your midsection, or their pituitary ovaries, where they've got the saddlebags on the hips and the thighs. That's significant, again, as you do a visual intake. I actually have in my office a chart, and I really like it. It has the body shapes, and underneath each of the body shapes I have written out what that represents. So usually when the client comes in, they'll go, oh, there's my body shape. So it makes it very simple. Now, many women are combinations. Now, and that's why the fulcrum is so important. On the combinations, it can be also because maybe in their 20s they had a thyroid issue, and that thyroid issue was never taken care of. So now in their 30s, it has developed into an adrenal issue. And then in their 40s, now they're perimenopausal, or now they have hormone issues. Maybe it's many years of being on birth control. So there's many different reasons for it. So again, what we want to do is do our history, which I'm sure everybody does, and then do our visual intakes. Now, as we design a jump start in here, again, as you can see, we go back to the adrenals. Now, again, with the adrenals, you're looking to do a jump start. This isn't what you would do on a hormone protocol necessarily. Again, we're not into the progesterone creams or any of the hormones. What we want to look at is the endocrine first. We want to look at thyroidin. This thyroidin is very gentle, yet as gentle as it is very, very, very strong. And I think it's because of the electrical signature that the Inno-Vita line has, because there's not a lot of lines out there that have the electrical frequency. And with the thyroid and the adrenals, you really want to support it with that electrical frequency. And then we have the Semifirm. Semifirm is very balancing to the ovaries. It's gentle enough that I have used it for some high school girls that have a lot of different problems balancing out their hormones, yet I've used it in higher dosages for women in their 40s, 50s, like myself in my 50s, but that is something that that you can do both. You can also, if you really want to be very, very gentle with a teenage girl, you can open the capsule and just use like maybe a half a cap. I do that quite a bit to be very, very, very gentle. Manafirm. The men in my office love Manafirm. It has been significant in helping for men that are having a problem with their libido or they're fatigued, a lot of fatigue. Manafirm helps with that electrical signature. I actually can use Manafirm prostate formula. It's a very good combination to use. And you can put the Manafirm with the adrenal and then the prostate formula, and you will see their energy increase, you will see their mental focus increase, and I have had erection, men that have an erection issues, that will increase. And then we don't want to forget the PMSYNC. Very, 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 very good for young women when it balances their PMS. The other thing that I have used this PMS formula is in women in menopause when they're very, very moody, because basically it regulates their stresses around their hormones. So it's a very good combination. Now, again, let's get back into, and then here's the liquid lines here. But let's get into now starting to look at balancing hormones. Now, within a few days, the one key when we get back to that hypothalamus is serologic. Serologic will actually go in there and electrically balance and stimulate the hypothalamus. Now, when you balance the hypothalamus, then you can go back and say, okay, let's check out the thyroid, let's check out the adrenals, let's check out the whole chain. When you feel the person comes back and they go, wow, my mind isn't racing, I don't feel like I'm in trauma all the time. I have a peace, an inner peace inside my body. Then we can go, okay, let's look at hormones. And with those hormones, do we need some Semaphirm? Do we need to maybe just do some PMS? Or maybe we just need to balance the adrenals, and in balancing the adrenals, we'll have a hormonal balance. Or many times, you balance the hypothalamus, and you go in and balance the thyroid, and what the person said, wow, you know, I was having hot flashes. Now I'm not having hot flashes anymore. One of the other keys with people coming in with hot flashes that they don't give credibility to, and I don't actually have it as a slide, so let me just tell you as a key, is the liver. Hormones are made in the liver. So if you go in and clean up the spleen and the liver, when you're first looking at the endocrine system, I have found about 75% of hot flashes will dissipate just in doing that. Now, tell them that this program is designed to create a fast change, because what you're looking for is to see, where did we create balance? Did we push the body so that it's nice and balanced, so that we can actually see what is authentic hormones that need to be dealt with? Or were they having hormonal symptoms due to the endocrine system being out of balance? Now, once you've done that and you go, okay, the endocrine system is balanced, this person really didn't need a whole lot of estrogen and progesterone, just doing some Semaphirm, balancing the ovaries, cleaning up the liver, we got the hypothalamus under control. Everything is balanced. The other thing that we want to look at here is the leaky gut syndrome. Because leaky gut, then you're going to start getting into the cesspool and going, if we don't deal with it, then we're going to go back to where we started. So we want to take a look at digestion. Are there any pathogens? Now, in a woman, in the uterus, if they still have their uterus, 90% of the time I have found pathogens are in the uterus. The uterus is a place for life. That's where we create life inside the body. So we're a wonderful, wonderful place for pathogens to grow. So I have a friend of mine and we kind of have it's like 9 out of 10 times balancing a woman for hormones. I always do a parasite protocol with it, because you want to clear out the pathogens that are probably most likely in the uterus. And very, very difficult to detect that. So we look at parasites. If they have parasites, they're going to have fungus and yeast. And as we know, most women are having a lot of candida issues. They have it especially a lot. They'll say they're itchy or they smell during their menstrual cycles. You may want to check and see if there's any viruses in there, just because of the fungus and the yeast. Bacteria also, because remember, bacteria is different than fungus, which is different than yeast. Heavy metals. Now, this most people have, but in Northern California, in the valley, we have a higher rate of heavy metals because of all of our agriculture here. So I find a lot of heavy metal issues, and if you don't get rid of the heavy metals out of the liver, I have not been able then to bring a complete balance to their progesterone, estrogen levels, their hormones, because again, remember, hormones are made in the liver. We're looking at some of the Inno-Vita products that will do a lot of this balancing, which is their Microsite, their Paramat, their ViroX, Bacto-X, Digesta, and Metal-X. You have everything you need right here, but I would definitely 100% look at the liver and look at their galactic or their X spleen. Now, If the person is literally a hormonal basket case, it is, in my opinion, and this is my opinion, it is more of the hypothalamus or it's their liver. So you can look on here for PMS. Don't rely on the stool samples, but you want to look at parasites in the liver. Look at working on their leaky gut. It could take up to 90 days to heal. And then have them do a test for pH and then suspect Candida. And definitely I always have them remove alcohol from their diet. I have them in the very first day. It is just standard Kathy. No sugar, no dairy, no alcohol, no soda pop the first month. It's just rule of thumb. Then the next big thing is wheat. Take them off the wheat. Okay, osteoporosis and hormones. That's the very big thing that doctors push a lot of taking stuff for the osteoporosis. But if you go in the osteopenia, but again, if you go in there and you correct the pH, remove for a while, remove a lot of red meats, and redo their diet, and go in there and clean up, bring a balance, and they go back in 6 months and have their bone density test redone, you will literally see that their bone density comes up. I deal with this monthly, where women will go in, it'll come back to me and they'll say, Kathy, the doctor wants me to take this medication to change my bone density. You go in here and change the pH. I love the CalComp. You go in there and you give them the CalComp. You rebalance their endocrine system. Get their spleen working. Get their kidneys working. Clean up the body, and you will literally, naturally, their bone density tests improve. It happens to me all the time. But definitely check them on the CalComp. You have to watch today, because a lot of women that come in and they've been to Trader Joe's or they've been to Rite Aid or any place off the street, and they'll be taking lots of calcium and lots of vitamin C, but it's junk. It is literally junk. You pull them off that stuff, you put them on the good stuff here, and they will balance right up on their calcium levels, and the calcium will calm their bodies so that they actually sleep better and they have less stress. A good little thing is if somebody really doesn't need something to sleep, but they're just a little on the edge in the evening, you put them on some calcium at dinner time. 1-2 hours later, their whole body just calms right down. Empower your women to take their pH. I do this with everybody. I used to sell the pH strips in my office. Now I just tell them to go get it at the health food store. Help them to understand what healthy digestion is. Ask them the color of their stools. Do they float? Are they light in color? Instruct them to pay attention to what their symptoms are and their cycle. And also, each month, the ovary is a different ovary that menstruates. Most women don't even know that. So help them to understand that, because they could have a problem with one ovary. And anybody that's a massage therapist may know this. Sometimes an ovary can come right out of the little spot where it floats, and sometimes just with one little adjustment, you could just put the ovary right back in. Okay, question and answers. I have a protocol sheet that I fill out and I give the client. I write down, I do food sensitivity testing, so I write out the foods that I want them to stay off of. I will also write on their protocol sheet the foods that will significantly help them. And then I write out, I have them also sign a waiver of liability so that I can write out, let's say I want them to take Adrenax and Galastic, then I can dose them out and actually tell them how much to take. And that way I can also do the marriages because I will have on my protocol sheet upon rising, breakfast, lunch, dinner, and at bedtime. And then I just fill that in for each client. Okay, that's a big question. On the hormones, when it comes to anybody with cancer, I really am extremely cautious and gentle. I will go in more through the endocrine, and I don't do a lot of like the Femifirm. I function more on their thyroid, their adrenals, their liver, and their spleen, and their brain, hypothalamus. Recovery, a lot of spleen, high dosages of the spleen, liver, and kidney, so that you can clean up from the chemo or the radiation, whatever they've been on. And then I do a gentle rebuilding of their endocrine system. Have had very, very good success. A lot of, I've worked a lot with mastectomies, prostate cancer, uterine cancer. But you want to hit the spleen, the liver, and the kidney very, very strong. And you have to be very guarded on the hormone because of your liability, and also with doctors do not want to stimulate hormones. High dose would be 2-3 times a day. I would not go higher. Now, one of the nice things about the Inno-Vita line is it doesn't take a lot. My normal dose on spleen would be 1, maybe 2 a day. But when you're dealing with that situation, 2-3 times a day, galactic maybe 2 twice a day, kidneys 1 twice a day, and then recheck them in 30 days and have them eat a lot. Right now it's great because they could eat a lot of watermelon and have them chew the seeds. If they can get a hold of the watermelon with seeds, it's best, and have them chew it. The pectin that's in the seed helps the kidneys. And when they've had radiation and chemo, the kidneys, the spleen, the liver becomes very toxic, and they will have a much gentler time, even if they're doing chemo and you're taking them through that, keeping their filters clean. Now, that's kind of fun because my grandson is 6.5 months old, and I do give him product. What I do with a 6-month-old is, because now they're starting to have food, and a baby should not have any, 0 wheat that goes in that system for up to 14 months old. So you want to read labels. Anything that's happening with a 6-month-old being asthmatic is a digestive issue. And so they're probably just starting to introduce food. And so check the foods. We give, like my little man, he has avocado, and he will have the orange vegetables, and that is it. Nothing else. You don't want anything acidic before 12 months old, and nothing till they're 14 months old of wheat, because their digestive tract is not fully developed until they're 12 months old. So you can open up a capsule. In fact, I did this last night with my little guy, and I put a half a capsule of Digesta in his mouth, and I did this because Mommy, we all went on a cruise, and Mommy got seasickness, and so she took some medication, and she did some stuff she shouldn't have done. But I did a half a capsule of Digesta, and then I did 1/4 of a capsule of spleen and 1/4 of liver, and just kind of cleaned up his system because he's still being breastfed, and because of what Mommy took. Now, I also put it in the food. You can just open the capsules and put a little, and with a baby, once a day is very, very, very good. But I bet if you just change the foods and the digestive tract, and the spleen would be so significant, I bet you the symptoms would all go away. Worst case scenario, you may need just a tiny little bit, maybe 1/4 of a capsule of Adrenax for maybe 7 days. But the baby will clear up very quickly. No wheat. Wheat is the biggest, worst thing for babies. You start to work with the person first on their liver. And again, I go back to the liver and the spleen, and then add a little bit of Semaferm in there, and they should balance out. I'm 50, and I'm not having cycles anymore, and I do not have any hot flashes or sweats, night sweats, or any of those symptoms, but it's balancing the endocrine and checks their thyroid, because that is the greatest support in the 50s is thyroid, and believe it or not, I'm going to say it again, it's the liver. Clean up their liver and their thyroid, and then see what legitimately is natural menopause. The body doesn't realize it doesn't have the thyroid anymore. When you take a gland out, it creates an emptiness in the body. And so that electrical signature that when you do kinesiology or biofeedback, when you test the body and you test the parasympathetic, sympathetic that runs through that electrical signature in the body, you now have a break in that electrical signature. I have about 3 clients right now that do not have thyroids. They've been removed, or they have a goiter, or the thyroid is just shut down, and they've been on thyroidin for forever and a day. You want to go in and that electrical signature, bring balance electrically back to the body. Remember, the endocrine is a chain. And if you do that, it's pituitary, hypothalamus, thyroid, parathyroid, thymus, adrenals, testes, or ovaries. You get into that endocrine chain. And when the thyroid is removed, or even people have had adrenals removed, or the ovaries have been removed, you've now broken the chain electrically. So you want to reset it. And that's what's really cool about Inno-Vita is their products versus other products are very electrically stimulating. And just putting that signature back in the body, you will find the endocrine will balance back faster. I always, it's in my paperwork that I do not tell clients to go off of any medications. They have to sign that I've said that. And so what we do is you want to come up alongside the medication. And nothing in Inno-Vita has any conflict with any medications that I have found. So I personally have an extreme comfort level with using it. So I have them take whatever I'm going to do alongside their thyroid medication or their hormone medication or whatever else I'm doing. Then after a couple of months, I tell them, now you're feeling better, your body is balanced, now go back to your doctor, because generally they all want off their medication. So I tell them, go back to your doctor now and tell him that you want to start weaning off your medication. So then as they wean off the medication, I may increase the dosage a little bit so we balance the balance in there. And then slowly they'll come off it. Now, if they don't want to come off it, it's generally if they're in there with a thyroid problem or a hormone problem, or, you know, I've been taking Premarin for 10 years and I'm still having hot flashes, or I'm not sleeping well. You can still give them Semaferm. You can still give them even the PMS to help for a little bit, and you will see their energy levels come up. Generally, when that happens, most of my clients want off the med, but I do not tell them to go off the med. Yeah, that's very, very difficult. I've done that once with a client and was very, very successful. I've got a couple of other clients that's really hard. The best I've done with some of the others is we've taken them down to just the bare minimum of what the doctor said they could do, because they were having lots of side effects. Again, with the liver, the kidneys, having some side effects. Because if you go in and you just look at the side effects to that, there are a lot. So it's been a 50-50 on that. But the positive is we've been able to take them down to a quarter of what the doctor had, and then we've used an endocrine. Now, in that case, you cannot just focus on the thyroid. You have to support the pituitary with the thyroid in that case. You have to support the pituitary and hypothalamus. Otherwise, you can't do it at all. What I have found with heavy cycles is they're actually having a mineral imbalance. So they're probably having an absorption issue. So you want to increase their calcium is huge to increase. So you would use the Inno-Vita Cal. Possibly look at some other minerals with that. And then, I'm redundant, I know, but check out their liver just to be sure. But there's an absorption, so digestive. That's an absorption issue no matter what the age is. When there's heavy bleeding or breakthrough bleeding, check their liver. You could also look at leptaria, because leptaria can, even though it is used for sugar, it actually helps a lot in absorption and minerals. So check out their leptaria. But that's an absorption mineral issue.